In this presentation, I'm going to briefly review the impacts of peripherally evoked responses in TMS EEG measurements, followed by the currently proposed approaches to deal with this potential confounding factor, and then introduce the concept of our optimized sham procedure and the results of using it. Then finally, I'll propose some possible future directions to take. Since the early developments of the TMS EEG technique, researchers have realized that it's not only the direct cortical stimulation that generates an EEG response, but also the collateral sensory stimulus caused by the TMS, which includes auditory stimuli caused by the TMS triggering click sound, and the scalp sensation under the TMS coil, which provokes a noticeable skin perception. They all elicit EEG responses, which we call the peripherally evoked responses in TMS EEG. Now, these responses are in many cases so salient that the TMS EEG response can be visually indistinguishable from the responses of purely sensory inputs, as seen here in the results from the study on the right, which applied a sham procedure designed to simulate all the sensations from TMS, but without the direct cortical stimulation. So what are these peripherally evoked responses? They are stereotypical responses widely observed as caused by many different sensory perceptions. They occur as a pair of deflections that peak in central electrodes in the EEG, first around 100 milliseconds after the stimulus and then 200 milliseconds. They are believed to represent the processing of incoming salient sensory perceptions regardless of the modality, and involving several cortical regions. Now, having said that, there are many salient sensory inputs caused by TMS that can be responsible for generating these peripherally evoked responses, from the auditory click to the collateral stimulation of nerve endings in the scalp and of cranial muscles, and the twitching of a limb in case we're using TMS over the primary motor cortex at suprathreshold intensities. And how can these impact TMS EEG experiments? Well, here we have two examples. On the left, a study demonstrating a significant reduction of the amplitudes of the EEG response to TMS around 100 milliseconds in patients with attention deficit disorder. On the right, we have a pharmaco-TMS EEG experiment also demonstrating a significant reduction of the amplitudes of the EEG response to TMS around 100 milliseconds when subjects take benzodiazepines. Now, it is possible that these effects are the result of modulatory effects of the disease and the drug on the cortical responses to direct stimulation by the TMS. And it may also be possible that what is being observed is the modulatory effect of these conditions over the peripherally evoked responses. Now, how to disentangle these? There are reasons in favor of both possibilities here, but one thing to bear in mind is that both ADHD and benzodiazepines intake have been found to decrease the amplitude of sensory evoked responses around 100 milliseconds. Now, this should reinforce the need for accounting for peripherally evoked responses in TMS EEG experiments. And the most straightforward way to deal with this confounding factor is to apply a condition that acts as a control for the sensory EEG response, with a sham procedure that recreates all the sensory inputs from the TMS. In order to create an ideal control condition, we need to take into account the sensory modalities that are being involved. Now, here I will describe the idea behind the realistic sham, which is to deliver these sensory inputs in a way that will be equal to that of the real TMS. Now, for the auditory input, we can apply masking noise, which obscures the perception of the TMS pulse sound. There are some very effective methods to generate this masking noise, and I recommend its use. However, in some cases, it might not be enough. For instance, when the TMS intensity is too high, and consequently the loudness of the click. In these cases, another method can be added, such as a sham TMS coil or a second TMS coil positioned away from the scalp, but also producing the same click. Now there's an issue of the scalp sensation and muscle twitch around the stimulated cranial area. These we can simulate by means of delivering electrical stimulation to the scalp area. And if we put this all together, we have the realistic sham. The real-life application of this method, however, is not so easy, and the outcomes of studies that attempted it might leave much to be desired. This is because it is extremely difficult to accurately simulate the sensory input of TMS. In the study, in the top left, we see that individuals had a significantly different perception of the sham compared to the real TMS. The possible consequence is that the evoked response from the real TMS might be significantly different from that of the sham, as suggested from results from these other studies, which could not entirely account for the confounding effect of peripherally evoked responses in TMS EEG. And this is what I illustrate here, where the sensory input from the sham procedure is inferior to the real TMS. And when the comparison between these two might then detect differences that are actually still part of the peripherally evoked responses in TMS EEG. Now this problem is also repeated even if one uses a sham procedure which has a significantly higher sensory input compared to the real TMS. Ideally, this should be solved with an ideal realistic sham that perfectly matches the sensory input from the real TMS. However, this is a challenging endeavor, as attested by these previous studies that I mentioned. Also, how should we calibrate this ideal realistic sham? Should we be based on psychophysical assessments, or should it be based on individual subject N100 P200 amplitude obtained from the real TMS? Instead of trying to make something out of it, we decided to take a whole other direction with the optimized sham. So in this optimized sham procedure, we still make use of a sham that kind of mimics the auditory input and uses scalp electrical stimulation. However, we use considerably higher intensities. And the reason for this is the power law of sensory input response. This implies a logarithmic relation between the sensory input and the neurophysiological response. So here in this example, we have two different inputs that lead to significantly different neurophysiological responses. However, if that difference in input remains the same, but offset to a higher overall intensity, then the difference in the neurophysiological response will be considerably smaller. That means that if we apply stimuli in a high enough intensity in both the real and the sham conditions, whichever difference in the perception there is would not cause a significant higher different neurophysiological response. In this case, then, the response from the sensory input from the sham and the real TMS will be statistically equal. So in our design, where we apply these electrical stimulation with these electrodes on the scalp, using this particular setup, we figured that if we reach electrical stimulation intensities of above 3 times that of the individual sensory threshold, then there will be little increment in the EEG response amplitude. So, theoretically, if we use this intensity in both the real and the sham conditions, even if there is an objective difference in the perceptual input, given for instance by the real TMS in the real condition, the resulting difference in neurophysiological responses would not be significant. It follows that even if the peripherally evoked responses in both sham and real are of large amplitude, whichever difference found between these two conditions will only be explainable by the direct cortical activation by the real TMS. If we use this method to target the primary motor cortex using subthreshold intensities, we can identify EEG deflections attributed specifically to the direct cortical activation. These responses centered around the ipsilateral sensory motor regions and observed in latencies even beyond 80 milliseconds, where the peripherally evoked responses should be predominant. Now, these results here are not new, as they have been described and suggested by many previous studies. What we're doing here is mainly emphatically confirming that these can only be ascribed to the direct cortical activation by TMS and not to peripherally evoked responses. We can also apply the same idea to TMS-induced oscillations, where the sensory inputs are also responsible for a broadband power increase after the pulse. The subtraction of the response from the sham reveals the specific effect of the primary motor cortex direct stimulation, which is an early beta increase in the ipsilateral sensory motor cortex. Now, this method is not without limitations, and there are some issues to mention. Issue number one is that any given sensory overload only encompasses a certain degree of magnitude. So, if this is surpassed by a TMS condition that uses high sensory input, for instance, if we try to stimulate the cerebellum, which evokes a lot of sensory responses, then the intensity of the sensory input necessary to attain the same sensory overload will be considerably higher and needs to be adjusted. Issue number two is the possibility that sensory inputs modulate the cortical response. Now, this has been suggested by studies showing cortical spinal excitability modulation by sensory inputs. Now, this has not been shown to be observable in TMS EEG experiments yet. However, if this were true, it will mean that the resulting cortical response in using our optimized sham procedure might be modulated by the sensory input and thus not represent a true cortical response. Now, I believe that here we have demonstrated a procedure that can effectively exclude the peripherally evoked responses from TMS EEG measurements and thus revealing the true cortical response from direct activation by TMS. However, I understand that this is not a perfect solution and might even be a bit of an overkill. Now, this means that I believe that this can be improved. First, it will be important to investigate whether sensory inputs significantly modulate the EEG response to TMS. Secondly, this method can be used as a gold standard to then develop a truly realistic sham. Now, the development of this ideal realistic sham will be challenging, and many things will have to be taken into consideration, such as whether the subjective perception should be taken into account, or simply the amplitude of the N100, P200 elicited by the real TMS. These are things that will have to be sorted out. Because then finally, it will be important to put into practice whichever method we decide is the best, to then test whether the results observed in previous TMS EEG studies are indeed the result of cortical direct activation by the TMS, which will then reiterate the validity of the whole method. For now, I thank you all for your attention.